Hello, my name is Michael, and this is my presentation on innovative strategies for nurse educators. Introduction. So the purpose of my presentation is to understand and demonstrate the understanding of an effective teaching strategy and the varying strategies that are available for educators. I'll go into the culture and how culture is utilized in education. I'll compare the different strategies that are available to educators and strategies that I've learned so far during my clinical rotations, some of the barriers and the opportunities that are present for the educator, my personal takeaways and what I've learned during my time as an educator student, and then my conclusion. So, from one of my sources, IELTS 2024 states that novice students often lack sufficient learning skills and are not adequately prepared for the challenges and complexities of the nursing curriculum. Individuals who are unable to adapt to the rigors early in the program struggle with course performance. They suffer low self-efficacy and subsequently fail to be successful. That's a direct quote. I think that effective teaching strategies will empower the instructor to be able to observe these struggles from novice students, implement feedback and guidance that will increase awareness. Students might be unaware of their learning styles as well and are not optimizing their approach to learning because they have that lack of knowledge of their learning styles, particularly students that are new to the pace of the college studies. Awareness and comprehension of a person's style of learning enables that person to tailor the learning environment for optimal outcomes, which is a quote from Bradshaw 2019, our textbook. Again, with encouragement from the instructor, the student's able to explore different ways of thinking. So in this way, specialized and experienced knowledge from the instructor as a seasoned practitioner is indispensable. Again, that's another excerpt from Bradshaw 2019. The attributes of a successful professor for teaching success are four that I drew from Bradshaw. The presence of the professor or the educator, promoting learning, and then showing that the teacher and educator is also a learner, and the educator's enthusiasm are all attributes that are significant for an educator to have in an educational environment. So far from what I've seen during my clinicals, addressing these, for example, the presence of the educator is important. I've seen it. My current educator that I'm following, Dr. Coleman, has been instrumental in delivering the curriculum in a way that is enthusiastic, that is beneficial, that attracts the attention of the students and makes it interesting, frankly. And in this way, they're able to promote learning by keeping the students' interest, presenting the information in a way that is effective, that promotes not only memorization but understanding, and then also acknowledging that teachers are also learners and continue to learn. What I've seen from my instructor is that the strategies that the instructor implements are learned and molded as the time goes by. Different students have different dynamics, different personalities, different ways of learning, and the teacher, the instructor, educator continues to learn in this way to implement the best practices. And then the instructor's enthusiasm is also important, because if they make the material boring, then the material is going to be potentially not absorbed by the student. So the instructor's enthusiasm plays a large part, and the way that they demonstrate that enthusiasm, not simply just being excited about the material, but the ways that it's presented will also go into during this presentation. Finally, another consideration of effective teaching strategies is the understanding of the adult learning theory, which empowers students to take charge of their learning to accomplish objectives, which also mirrors the environment of professional life. So for nurses and nurse students that are beginning their career in nursing, it's important for students to begin to take charge of their own learning and understand what methods work best for them, whether it be learning directly from lectures and textbooks, interactive learning from virtual media, or simulations. Next, we'll go over culture in education, starting with the history of culture. Then we'll go on to the classroom environment, followed by students and faculty as it relates to culture in education. We'll go over cultural considerations, and finally how to minimize discrimination. So the history of culture, we'll go over nurses. The history of nurses is that culturally nurses were women and physicians were men in the early years of culture. Between the early 1800s and 1965, discrimination and segregation was widely accepted and excluded people of color or foreign descent and specific religions. As nurses and nurse education started to develop, and just medicine in general, women were also excluded. But nursing, as it was known at the time, was restricted specifically to women tending to people at the bedside, as is depicted here in this picture. School segregation was also very prevalent at the time during this period. And they were segregated by race or religion. Because schools were private and religiously sponsored, they had to fill quotas for preferred demographics, such as Christian schools, Jewish schools, and specifically white races. During the 1950s, there was very low retention of minorities once education expanded and access was given to minorities to pursue higher education in the healthcare field. Minorities that did enter the programs had very low retention due to failure in connecting with culture and addressing inequities of students. The community college movement in this era provided access to education for lower incomes. Convenience was improved for access to education for working professionals seeking degrees and progression. Students at the time during this era provided care for patients as opposed to nurses and healthcare professionals that were trained in higher education. Those individuals mainly filled roles in administration. During the 60s and 80s and 1980s, women were discriminated against attending university and college programs. During the 1990s, affirmative action led to recruitment of increasing number of minorities into college programs. And then in the 90s, access to education expanded for disabled Americans. And as you can see, the movement to raise the status of women began in the 80s to allow women to enter into higher education to attain those registered nursing licenses and higher education as in bachelor degrees. in culture in the classroom. So um, the hospital development efforts were started in the 40s with the Hill-Burton Act, which was passed by Congress to provide funds for hospitals to renovate their facilities and build new buildings, which increased the need for healthcare professionals to include nurses. Nursing schools were very discriminatory at the time, as I mentioned before. This included discrimination against men, as nursing was still seen as a female only profession. But even female students who were pregnant and potentially out of wedlock were discriminated against from attending. School segregation continued, which was outlawed during the passage of the civil rights legislation, and then schools began to merge, but change was gradual. Black students were only permitted in still segregated hospital wings to care for only black patients, and administrators were mainly Caucasian, so patient care was still segregated. The classroom expansion, classroom shifts over time from lectures and books to hands-on clinical simulations, electronic sources and aids, synchronous and asynchronous distance education, communication methods, integration of relevant systems like electronic health record management, learning management systems, artificial intelligence, and simulation labs. So these are all technological and different learning strategies that were adopted in the classroom and were affected by culture. These shifts in the classroom created gaps in performance. Some minority cultures had difficulty with learning in these environments, and these difficulties could be attributed to societal inequities and discriminatory practices. Again, these difficulties could be attributed to access to resources, as the segregated learning environments created gaps and inequities, which created poor access to certain individual cultures. As far as students and faculty, according to Bradshaw, first-generation college students may not have opportunities to discuss coursework at home, or may not be able to get help with understanding the college environment. Some of these examples that were mentioned in the book, in our textbook, are first-generation college students, as I mentioned, Asian Americans, which some of their customs and rules could be attributed to non-participatory perceptions, such as avoiding eye contact and remaining quiet during group discussions. But these can be understood to be lacking eye contact out of respect for authority and consideration, and not interrupting others during discussions out of consideration for others. Native American support. Native American students are closely tied to their families, and success in the classroom correlates with a strong sense of belonging and support from the institution. So understanding that can arm Native American students with appropriate resources for success. African Americans prefer a lot of cooperation, as well as Latino students in group-oriented settings. They are less competitive than European Americans that thrive in competition and having their opinions heard. American-born students and that are immersed in the American culture oftentimes are non-participatory and may appear shy, which those individuals would favor smaller group discussions rather than having large classroom participation. Other cultural considerations. According to Bradshaw, educators are expected to incorporate a social justice mindset that overcomes years of societal beliefs and cultural norms. in an effort to give multicultural students positive learning outcomes. So an educator would want to create a patient-centered learning environment, um, and understanding how cultural diversity plays out in society will help to shape a student's mindset. Um, Improving nursing students' cognitive abilities will develop moral values that appropriately relate to the institution of nursing. A student must be able to readily establish relationships with patients, families, and members of the healthcare team. Interactions with all of these individuals will include a variety of cultures. This was from the Khadiji reference, 2023. Another cultural consideration is encouraging critical thinking. And then teaching communication strategies. So from the AACN, AACN emphasizes cultural competence as a core part of nursing education. The AACN states that hospitals should prioritize hiring culturally competent nurses in order to improve patient satisfaction and health outcomes. Cultural consideration directly aligns with professional standards, such as this standard from the American Association of Colleges in Nursing. Minimizing discrimination. So how do we reduce discrimination in a classroom setting? Reducing feelings of anxiety and isolation in multicultural students. This is a direct responsibility of the educator to ensure inclusion for all students. Developing sensitivity and awareness of specific issues that affect learning. Developing knowledge of resources and services available to community faculty and students. A lot of these resources are widely available even here at Cal Baptist that allow students to find resources that support their not only their learning, but also their cultural development. Comparing strategies. So 3 strategies that we discussed were simulations, role play, and problem-based gaming. So simulation-based experiences, these are educational strategies that resemble real situations. They go beyond the didactic portions of programs to demonstrate transfer of knowledge to practical settings. These environments help to develop students' critical thinking, professional relationships, communication, mobility, motor skills, hearing, visual ability, and tactile sense, as mentioned in Bradshaw 2019 on page 72. The advantages to this method is the high fidelity opportunity for the student, which comes from realistic, high-paced, dynamic environments that closely mimic the clinical setting. Disadvantage of this strategy is that setting up a simulation can be very complicated, costly, and time-consuming for an educator. A facility such as Cal Baptist that has all of these resources already in place can help ease the burden on the instructor in setting up the scenarios and focus mainly on curriculum. Some of the applicable domains, the applicable nursing domains here are Domain 1, which is knowledge of nursing practice, Domain 6, interprofessional partnerships, Domain 7, systems-based practice, Domain 9, professionalism, and Domain 10, personal, professional, and leadership development. Role play is another strategy. Role play is a little bit of a lower fidelity as compared to simulations. These role play strategies can include instructors, peers, or task trainers. Basically, the role play lower fidelity means that there's less real world aspects such as mannequins or actors or simulated medication administration or use of technologies. Role play typically involves instructors or peers that simulate interactions that occur in clinical settings. Task trainers can also be instructors that are trained to conduct simulation-like scenarios in a less dynamic environment that removes some of the stressors of a simulation setting. The disadvantages of this strategy, like I mentioned, is lower fidelity, lower realism, and a learning opportunity, less learning opportunity as compared to simulations. The advantages of this strategy is that it's readily available. with very little need for outside inputs, and the instructor can provide immediate feedback to the learner. Problem-based gaming is another strategy. It's a simulation-like experience that newer generations are used to with virtual reality and gaming. It enables opportunities for repetitive practice. The problem-based gaming combines scenario-based experiences with game-based learning and consists of digital patients with evolving conditions. It mimics some of the gaming trends that include escape rooms, virtual simulations, and case-based games that individuals are already used to. Other gaming type systems that can be used are voting systems that permit anonymous responses, or things like Expert, which we've incorporated actually with my clinical instructor. Some open source sites can also be utilized for no little charge, like Quizlet. Virtual experiences can also help to blend traditional methods that are evidence-based and appeal to psychomotor skill development. And the advantage is that these are easily adaptable and relatable platforms. Disadvantages, again, like I mentioned before, they're lower fidelity because there's no or minimal real-world feedback from a digital patient that can create a false sense of communication. Applicable nursing domains: Domain 1, knowledge for nursing practice; Domain 6, interprofessional partnerships; Domain 7, systems-based practice; and Domain 10, personal, professional, and leadership development. Some of my personal takeaways: the impact of learning new ideas about teaching strategies will be felt significantly by my nursing students and fellow nurses in the clinical setting. I will need to incorporate updated strategies as I learn about new nursing techniques, new technologies, and changes in demographics of learners. Innovative teaching strategies are important to continue advancing the field of nursing. By implementing fresh ways of thinking and approaches to learning from new perspectives, new teaching strategies can be implemented and continue to build on the successes of curriculum and avoid stagnation and mundane curriculum. Simulation and role-playing strategies, I think, are the most important teaching strategies to facilitate learning in the hospital and academic setting. As an educator, running simulated scenarios can help see how critical actions of nurses have developed, and will be able to identify gaps in communication, procedures, and patient care. And then role-playing can help to address significant subjects that are rarely seen, but sometimes often require practice, such as ethical decision-making, ethics discussions, and role-play scenarios that facilitate learning. Now, in conclusion, we talked about understanding effective teaching strategies, understanding culture in education, how it affects our students and their successes, and then comparing strategies for educators and best practices. Finally, as a future educator, I've learned that the ways that simulations and role-playing can have significant beneficial effects on student progression and preparation as students progress in patient-facing roles in a clinical environment. And my references. Thank you.